I'm Kirsty Boyd from Ottawa Plastic Surgery. Today we're going to talk a little bit about the use of photography in cosmetic surgery. In a world where there's more and more access to smartphones and technology, Snapchat and other kinds of imaging, photography is really prevalent. And a lot of times photography is really helpful in both helping us to make decisions and helping us to understand what people are looking for. But there are some limitations, and that's what I'm going to talk a little bit about today. Photography is most helpful when someone picks an image that they've either found online or in another method that shows what they're looking for. But it's really important that the photography that they're using as an example actually matches them in terms of their basic size and body measurements. For example, if you come in with a picture of someone who's very, very tiny with very large breast implants, but you're not somebody who's very tiny, it's very hard to mimic that. Or if you say to me, I think I want these implants because this person has them and I like 350 cc's, sometimes I'll say 350 cc's looks very different on somebody with that frame versus on somebody with this frame. So it's really relative to your body and your positioning. We make use of 3D photography all the time. We have imaging techniques that allow us to simulate putting in an implant to show you what it might look like and to give you some kind of a hint about what to expect. The thing is that the computer is actually trying to simulate 3 dimensions by using 2 dimensions. So the images aren't perfect, and sometimes what we give you isn't exactly what things are going to look like. Often we can make it better than what the images look like on the screen, but sometimes people get really tied into the photograph and say, this is what I'm going to look like after surgery. It's important to remember that natural tissue is not the same as photography, and no 3D imaging is able to completely mimic what you really will get in real life. The best thing to do is to use photography as an adjunct to help you describe to your surgeon what you're looking for, to help surgeons to describe to you what is possible and what isn't possible, and it's best used when we're picking people's frames and body references in areas of body that are similar to you. So when you're looking for photography to take to your surgeon, try and pick people that have a similar frame and then focus in on the area that you're looking for, and then you'll have to have a frank discussion about whether that photo actually matches something that's possible in you based on the actual tissue and what we have to work with. So photography is a really helpful adjunct. It's something that we make use of both from the surgeon's offices but also with people bringing it from afar. But we have to make sure we're using it in the right context, and we have to remember that the photography is not always representative of what you might actually have and find. Thanks.